I'm back again with more words of wisdom. I keep having to follow on. I promise I'll stop. This will be the last one. And Tony, I suggest you turn off now because you're not going to like this one. So this one really is in response again to comments that came after yesterday's videos. And so this really is about depression, anxiety, and for those of us that suffer from those illnesses. I have suffered from depression, probably from my teens, but diagnosed from in my 30s and treated with antidepressants from in my 30s. And I have taken antidepressants for 20 odd years now. These are mine. These are my pills. These are my drugs. I've got duloxetine, Cymbalta, which is for the depression, and I've also got quetiapine, which is just a tiny bit of a mood stabilizer if I need it. And I've taken those, as I say, for 20 odd years. I've occasionally tried to come off them. It's never worked. I don't really know why I've bothered. I suppose because, and this is what I wanted to say, like so many of us, I felt initially a shame in having to take the drugs, that it was something lacking in me, that I couldn't cope, that I was weak, that, you know, strong people could manage without having to take drugs. It was just a case of pull myself together and get a better attitude of mind. And really, when I was first diagnosed with illness, with depression, that was a horribly prevalent attitude, even amongst GPs and doctors. It isn't now. I have to tell you that it isn't now. They are so much better and so much more clued in. But I was very lucky, really, that I got into a good system and I got in with a good psychiatrist and I got the drugs and the treatment that I'd needed. So this attitude that you shouldn't take pills, it drives me mad. If you had level 1 diabetes, forgotten the word, but you know what I mean, you'd have to take insulin. You wouldn't have any choice. You wouldn't think, oh, I think I'll give it a bash without insulin, and if I die, well, you know, but, you know, I really don't want to have to take insulin. If you've got heart disease, you take the drugs for it. If you've got a headache or a migraine, you take the drugs for it. We don't sit around thinking, oh, God, it's so shameful. I've got a migraine. I'm going to throw up, but I'd better not take any pills because a strong person would be able to get through. It's a stupid attitude. It's because it's a mental illness, because it can't be seen, and because it is still so misunderstood. The word doesn't help. You know, depression and anxiety sound like such normal feelings. Those of you that suffer from them will know that, you know, a bout of depression is nothing to do with feeling sad. I get depressed in its normal term every now and then. We all do, but that is absolutely nothing to do with the depression that I suffer from. That is a very different place to be, and I'm sure the same is true for those that suffer from anxiety as well. It's not the same as when I feel a little bit worried about something. It's a clinical condition, and if you read up about it properly, it's about brain chemicals, and there's various reasons why those might be unbalanced. I'm not going to go into them all. But there are, and you need to get them balanced. And the best way to do that, or if other things don't work, drugs may be what you need. And for me, drugs gave me a place, a level playing field where I could then work on the issues that I had. Sorry, I've got a hair right on my nose. It's really itching. So yeah, they leveled the play. I remember when I first took antidepressants, after the first few weeks, when I didn't feel so good, and they just slowly started. I thought, my God, this is how everybody else always feels. No wonder they can cope. No wonder they manage. It's a different world. It's a different place. It's a whole different mindset. And of course it is, because my brain chemicals have been changed. That's what they do. If you have a passing depression, perhaps in a reaction to something, you may be able to take antidepressants for 6 months or so. They'll deal with it, help you deal with the situation, and you can stop taking them again, and that's fine. But if you have, sorry, there's the hair again. Let's get the little bugger. Get off. Get off. If you have what's called endogenous depression, or it was when I trained, which is a different thing, it's just with you, and you will most likely need to take antidepressants for life. And don't worry about that. So what? So what? You don't have to tell anybody if you don't want to, but I would. I'd get out there and tell them. It's just an illness. I've had so many different types. I've been in hospital with depression. I've been in an NHS hospital, you know, in the loony bin. I've been in one of those. I've been in a lovely private hospital. I've had every drug going. I've had antipsychotics, I've had lithium, I've had ECT, and I'm not telling you these to try and shock you. I'm telling you them because they're just the treatments I've had for an illness that I suffer from. That's all. If I said to you, well, I've been in hospital, I've had a triple heart bypass, which is a fairly dramatic kind of operation, you wouldn't think, oh God, you know, I should be brave to say that. You'd just think, oh, poor soul. It's just the same. It's just the same. It was a very serious illness, and I needed some very serious treatments. So for all of you, and I know there's lots of my friends on my page who suffer from depression and have the same issues, I don't know. I just want to put it out there. I just want to put myself out there and say some of us need to take medication. It doesn't make us mad. It doesn't make us loonies. It doesn't mean that we can't cope with life. It doesn't mean that we don't live perfectly normal lives. I mean, I'm probably not perfectly normal, but I live a perfectly normal, or I live my life. People don't walk past me on the street and go, look, God, it's a loony. They don't. Nobody would know. I am just choosing to tell you. So please don't be ashamed of it. It's an illness. Get treatment. And one woman had put a comment on one of my things about she thought she might go to the doctors. Now, please do. Doctors are so good now. They're so clued in. And they will help you. They will help you. They won't laugh at you. They won't say, oh, come on, buck up. I can remember one doctor once saying to me, well, what's the matter with you? You've got everything, haven't you? You know, you've got a lovely life. What are you feeling sad about? They won't say that to you now. And if they do, to be honest with you, if they do, they're just a bad doctor, and go and see another one. Get help. Get help. The other thing I was going to tell you about on the same subject, I'm sorry, this is a bit of a medical one here, but I am going to show you a quilt at the end, is this book. I'll set the screen here. Put it to the side, I don't think. There we go. David Burns, Feeling Good, The New Mood Therapy. Now, this is the smaller book. You can't really tell this. There you are. That's better in scale. It's fat, but it's a little book. And this is a really old one. There's pages. This is my scoring page falling out. But the pages I use in this the most are these ones, which are a depression. Oops, you can see how much I use it. Depression checklist. And I have used that. How long have I been using that? Must be 10 years or more. And I make a score on that every single week. And you might think, oh, I'll frig the score and I'll cheat. But it works. It's a surprisingly resilient testing tool. And I do my score each week. I always have a book for it. So this book is just full of scores for weeks and days and months and years. And it just goes on and on and on. And then I transfer my score. I think that's a clean one, it is, onto, hang on, bear with, onto a graph like this, so that I can see over the year what's been going on, when it's gone up, when it's gone down, and I put little notes at the bottom that tell me what was actually happening. So for instance, here, where it really, here, where it really, where it shoots up, I've put a little note at the bottom to tell me, what was going on there. That was, tried HRT. Absolute disaster for me. Absolute disaster. Didn't work at all. Just made things worse. So I've got lots of these. I've got years of these graphs, and what they help me to do is, it's not just for interest's sake, interesting though it is, they help me to track my illness. And something that you can probably relate to if you do suffer is that you're never sure, because of the overlap between the words particularly, you're never sure whether you're just feeling down and having a depressing time, or whether you are actually becoming clinically depressed. And there is a big difference, but it's not always so hard to actually identify, particularly when other people are telling you to pull yourself together. So this is 100% accurate for me. It always tells me when my score starts going up on this, I know I am heading into depression, and I need to look at things and need to work out why. And the longer I do it, the better I get at identifying what it is that's going on, and I can deal with it. And really, since I've been using that and my pills, I haven't had any I certainly haven't had to be hospitalised again, and I've managed to contain my depression. I still get bouts, I do, but less than I used to, and I managed to live with it. I live alongside my depression now. It's part of my life, and actually I see it as quite a positive thing now after all these years. It helps. These scores are usually about when I'm doing things I shouldn't be doing, seeing people that aren't good for me, indulging in activities that aren't good for me. And my score will highlight that for me, and I can then deal with it. So I think that would be a really positive thing to do. It's a bit of a pain once a week. Stephen always says to me on Sunday nights, used to, do you score? Do you score? But it gives you a marker. It gives you something that's not just your own opinion. It gives you a marker as to where you are. So I thought I would tell you about that. And then here we are, coming up to 10 minutes again. Brilliant. Hope you're still not watching. I hope you're not still watching, Tony, because I'm no doubt getting on your nerves. So I was going to show you a couple of pieces actually about, I thought, seeing as we were talking about depression, I was part of an exhibition with Art Textiles made in Britain last year, where the theme was identity. And I worked on the issues that I've had with my identity and my depression. So one piece I did, I'm going to try to do this without hitting any buttons down here. I've got a box. I'll put my box down. Okay, get in there. So this piece, let's it's not so easy to show. It was a hanging piece, okay? And each page, these are made from these. Can you see on here down the edge? These are pulled out of my scorebook. You know, I said that I kept scores. Well, these were out of the first scorebook I had. And each page of this hanging, let me see these pages, is one of those pages torn out and mounted onto calico, and then 2 pages are put back to back and the whole thing hangs. And each of these pages, it's called Keeping a Score for Life, which basically I know I'll have to do, and I also keep a score because it gives me a life, so it has a double meaning there. And each of these pages are about things and parts of my life that help me deal with depression, that have maybe caused depression, or that are part of just my life and me being me. So, you know, this one here is about my business. There's Hillary B. There's some leaves and jelly prints on there. This one, that was when I met Stephen. This one's about my love of the beach and making work. This is about my work. Some of the images of some of the sanctuary pieces there. Dixter, of course, he features, the love of my life, and Shawnee, because they're part of how I deal with my depression. There's the beach. Dixter feature. Dixter gets in a lot, actually. I think it's clear that I love him. So there's the beach and my enduring love of going there to feel better. So that was one, and there's several of these, and each hangs, and the whole thing hung as a hanging installation. I should say these are going to be showing again, actually, I'll tell you that at the end. Let me put that down, show you the other piece. This is going to be hard to show you because it's big. I've only bought 1/3 of it in here, but it's a big boy. So, can you see that? You can't see me, I know that, but I'm going to move this around so that hopefully you can see this. It's a great long line of, not going straight, but I'm trying hard, of my face. So put it there. You can't see it there, but it's sort of, I can't do it so that you can see it, but I think you have seen it. So these are just canvases. This is a Thermofax. No, it's not. This was a stencil that I cut of my face and made some prints of it from a photograph of myself. And then I've basically altered these in a colour program on the computer and stitched them. And this panel, I mean, obviously it has references to Andy Warhol's pop art pieces, of Marilyn Monroe particularly, not because I think I look like Marilyn Monroe, but because sometimes what I look like has been a problem for me. And there's 3 of these that sit above each other. So you've got 1, 2, 3, 4, 5. You've got 15 A3 canvases there with just my face on in lots of different colours. Now, part of it, you know, colour is part of my identity, I think, as well. So that's one of the reasons for that. But also, it's called No Apologies. And it's meant to be really in your face, just me, lots of different me's, straight at you, and I'm not apologising for being me. So people might look at it, no, that's a very narcissistic piece of work, isn't it? Look at that. And I think, sod off, it's just me. I'm not apologising for being me. So that's what that one is about. And I'll just briefly tell you, because that's actually very handy, this, because that exhibition Identity, it showed at Festival of Quilts last year, got some brilliant comments about it, but it's also going to the Minerva Gallery in Wales, in Llanidnos, in May, for the whole of May. So the Identity exhibition, all of it from Festival, will be showing at the gallery for a month. I'm teaching a workshop at the end of the month. I think there's a place left on that because somebody had to cancel. Rosie James, fantastic artist, she's teaching, I think, at the beginning of the month. I don't know if there's any places left on that. And also Pauline Barnes is also teaching a workshop on using heat and water soluble fabrics to stitch onto. And there may be places on that, but if you have a look at the Minerva Gallery's site, you'll be able to see about those. But please do come and see the exhibition. My pieces will be hanging there, and pieces from all the other artists too. It'll be wonderful. So I hope that clip's been useful about depression. I'm not going to waffle on about illnesses every clip I do. Promise I'll get back to art and quilting, but I just felt I wanted to say that because it really matters to me, and it's yeah, it just really does. So I'll sign off now. I'm under 15 minutes, so that's beginning to feel pretty short, actually, and I'll talk to you again soon. Bye now. I know where it is. Bye now.